what we know is that, so there is a physician shortage, right? So if we include anything to daily work that takes longer, it's probably not going to be done. Also, I myself as a radiologist know that it's sometimes difficult for non-radiologists to have access to radiological data, and not every center worldwide has access to high-performance computing. Also, head-mounted devices in XR have been present for quite some time. I realize that what Medicalholodeck is doing is really revolutionized this field, but there are still some problems, meaning that there is high cost currently of head-mounted devices. Some are cheaper, some are expensive, but not every center is going to be employing these. There are certainly some workflow inefficiencies. Thank you, Mark, for showing how you do your work, but there's still a lot of problems, and some users still tell us about discomfort while wearing head-mounted devices. So is there any other solution that you could think of? And these are not the numbers of users of XR, but these are the numbers of smartphones worldwide. So in 2014, there was about 1 billion active smartphones. And by 2029, we expect 6 billion active smartphones. And this little image I created was supposed to show that the iPhone 16 is now currently faster than about 60% of the current laptops on the market. So we do have quite with a high-performance smartphone that there is. And this is a German newspaper that basically shows that we do have a problem currently, that so many children are using smartphones, but it also gives them a disadvantage, right? Because everybody in that generation knows how to use a smartphone, and you can't really get rid of it. So what we're currently doing is that we're including a solution in our hospital that allows for one-click access to XR on mobile devices, smartphones and tablets. And it allows you for immediate visualization on, as I said, iPhones and iPads. And what it allows for is broad accessibility, because it doesn't only allow for access of radiologists, but basically all healthcare providers within the hospital. And not only healthcare providers, but also patients. So patients, whenever they receive an exam, can basically decide whether I want to look at my classic CT or do I want to look at it in 3D in XR. And this is basically how we imagine our hospital within the next couple of years. We have physicians basically examining cases, planning in partially with head-mounted devices, partially on iPads. We have teaching, which we've already done with tablets, and we have patients looking at their cases in XR. And we believe that this is going to cause better care, improved communication, and lastly, what we think is most important, patient empowerment, because they probably understand better what their disease is. So we basically have these 4 fields, what we're doing with Medicalholodeck. So we're doing teaching on tablets and smartphones. It's patient education, or it's just basically showing their patients what kind of disease they have. We're also extending into new fields that's not just radiological data. I'll just move this right here. And then we have basically non-radiological data we're examining. So what we have here is 2 examples. We have, for our students, we have this dynamic kidney examination where we show different contrast phases of the kidney. And then we have a patient here who has a renal cyst, and we have one of our young attendees, one of our young fellows trying to find the cyst in ultrasonography, and basically has a smartphone in hand and can already look at the CT that was already present, and then for easier to make it easier to find the cyst. What we've also been looking into is how does it change treatment if we show our referrers the images that we acquire in emergency room, the images that we acquire in XR in real time. So basically we have a CT in the emergency room, patients receive a CT, and whether they have a dissection or a complex fracture, we can reconstruct these images within 3 or 5 minutes and basically have them on an iPad right next to the patient and look at them in 3D and see how that changes. And this is a case of a patient with a complex intrahepatic pseudoaneurysm that was very difficult to treat. And we in IR reconstruct these images to basically find a good access point of how to directly puncture this pseudoaneurysm and treat it. For patients receiving PET CTs, these can be very confusing for patients. It's a lot of dose, but they also contain a lot of information. What we did is a completely new way of fusing these images and then showing the images of patients in 3D. And especially for patients who receive repetitive PET scans, they can actually see how disease is decreasing over the course of therapy. And then they may be able to basically take therapy or the negative consequences of therapy that might be loss of weight, sickness, or anything in that form. It's just easier for them to understand what therapies are really doing. And this is something Alex is looking into. It's light sheet microscopy. It's basically not what we're doing on a daily basis, but it's just basically how we can involve other colleagues who don't deal with medical imaging every day or not classical radiological imaging as we focus it. But you can also integrate these into Medicalholodeck and have improved interdisciplinary conferences. And what we've been doing, we've been showing patients their images in XR instead of classical, the way we classically look at them in black and white. And 90% of patients favored XR over classical, the way of looking at images. We have med students we're showing classical radiological data, and also we have a questionnaire of how they think that on tablets whether this improves teaching, and the vast majority of students were also excited about this new technology. So what we believe is that including this way of XR on mobile devices really does have a lot of advantages in clinical and in teaching on a daily basis. We have a low data burden, it's very accessible, and it's intuitive. We call this democratized imaging, and we believe it's a scalable solution that you could possibly integrate into more or less every hospital. And we hope to gather more information in order to share this maybe more in the next year.